Good evening, everyone. Welcome in once again to another all-new edition of the Milford Informer. I am your host, Tim Coet. Well, while we have a few more weeks of summer still to go, we are officially putting our summer editions in the rearview mirror. We're now happy to be back with you each and every Friday night as we move forward now into the fall season. We have a lot to get to on the program here tonight, including a recap of all of the results from this past Tuesday's state primary election. We also have news on a big renovation project happening in Milford. We have news from the Milford schools, and we also have news related to Milford Regional. Let's get to all of the details on those stories as we present tonight's Top Stories Rundown. Tonight, we'll share the results from Tuesday's state primary, including the just recently decided results from the 4th Congressional District. Also tonight, Dr. Michael Connors joins us to discuss the rapid COVID antigen testing now being offered at all of Milford Regional's urgent care locations. And also tonight, we'll be joined by members of Milford's War Memorial Revitalization Committee to discuss the crowdfunding efforts to renovate Draper Memorial Park. This past Tuesday, Massachusetts residents had the opportunity to vote early by mail or vote live and in person at the polls to determine the winners of this year's state primary election. Most of the races, both on the Democratic and Republican sides, were known by the end of the night on Tuesday. Let's take a look back through all of the results relevant to the Milford community. In the race for Massachusetts Senate, the Democratic primary featured two heavyweights, with incumbent Ed Markey taking on Congressman Joseph Kennedy. After what was a long and at times contentious campaign, Ed Markey came out on top with 55% of the vote to Congressman Kennedy's 44%. Interestingly, Joseph Kennedy was the top vote-getter in Milford, besting Ed Markey by a margin of 2,814 votes to 1,992. On the Republican side of the state primary, it was Kevin O'Connor besting fellow challenger Dr. Shiva Ayadurai by a margin of 60% to 40%. So it will be O'Connor squaring off against incumbent Senator Ed Markey on the November general election ballot. For Register of Probate, the only contested primary was on the Democratic side, where John Dolan defeated Kasia Wennerberg 53% to 47%. The incumbent in this race, Stephanie Fatman, ran unopposed on the Republican side. In the race for Governor's Council, it was Paul DiPaolo defeating Pedrock Rafferty in the Democratic primary by a margin of 62% to 38%. Also on the primary ballot, incumbent State Representative Brian Murray and incumbent State Senator Ryan Fatman both ran unopposed. It is important to note that well-known Milford Democrat Christine Crean ran a strong write-in campaign to make it through to the November ballot to challenge Ryan Fatman. We are receiving some unofficial results as of the time of the taping of The Informer that Christine Crean was successful and does appear to be headed toward that November ballot to challenge incumbent State Senator Ryan Fatman. Finally, that brings us to the race that we followed very closely for you here on Milford TV all summer long, and that is the race for the Massachusetts 4th Congressional District. A total of 11 candidates were in a very crowded field to bid for their party's nomination in this race. 9 Democratic candidates, 2 candidates on the Republican side. We'll get to the Democratic results in just a minute, but first let's dive right in with the results on the Republican side, which saw retired Air Force Colonel Julie Hall squaring off against Dighton Parks and Recreation Chairman David Rosa. And as those results came in on Tuesday evening, it ended up being an easy victory for Julie Hall, who claimed victory in the Republican primary for the Massachusetts 4th Congressional District over David Rosa by a margin of 63% to David Rosa's 37%. So it is Julie Hall who wins the Republican primary. She will move on to the November general election ballot. And that leaves the big question, who will Julie's Democratic rival be on that November general election ballot? 9 candidates to choose from on the Democratic primary ballot. 7 remained active right up until the September 1st primary, with Dave Cavell and Kristen Eddowes suspending their campaigns in the weeks leading up to the September 1st primary. Eventually, as the night wore on on Tuesday night, it became clear that this was a 2-person race between former Brookline Select Board member Jesse Mermel and retired Marine Jake Jake Auchincloss, and the results again were very slow to be determined, continuing to keep an eye on those results throughout the week. Finally, on Friday morning, it was announced that Jake Auchincloss was the winner in this race. So let's take a look at the final numbers, as it was a razor-thin margin between these two rivals, counting every ballot over the course of the week, but it ended up Jake Auchincloss was declared the winner despite claiming just 22% of the vote. Auchincloss bested Mermel by a total of just 2,033 votes. So once again, it will be Jake Auchincloss who moves on to the November general election ballot, setting the rivalry between Auchincloss on the Democratic side and Julie Hall on the Republican side. Again, should be a fascinating race to follow over these next couple of months leading up to the November 3rd general election. And that is really where we put our political focus right now, that November 3rd general election. Of course, there's going to be a lot of developments over the next couple of months as we follow all of the races, including the presidential race, for, again, that November 3rd general election ballot. Should be fascinating information. We'll continue to keep you updated on anything relevant to the Milford community as we move forward here towards the November 3rd election day. But moving on now to our next top story, we do want to turn to some news related to Milford Regional. We had a chance to sit down earlier this week with a member of Milford Regional's physician group, Dr. Michael Connors, who provided some really interesting information not only on how the Milford Regional Urgent Care facilities are coping with new protocols related to COVID-19 and making sure to keep their facilities sanitary and keep all patients, whether they are COVID or non-COVID related, safe during these times, but they also provided us with details on the new rapid COVID antigen testing that is now going to be offered at all of Milford Regional's urgent care locations. For more details on all of this, let's hear now from Dr. Michael Connors. We are so happy to be joined on the Milford Informer this week by Dr. Michael Connors. He is a physician leader over at Milford Regional Medical Center's Urgent Care. Dr. Connors, we're so happy to have you on the show this week. Welcome.
Well, I'm thrilled to be here, Tim. Thanks very much for having me.
So a really important reason we want to have you on the show this week to talk all about the details of the new rapid COVID testing that is being made available at all of the urgent care locations. I want to get into all of the details on that with you in just a moment, Dr. Connors. But first, I'd love to just get some of your insight first. This has been such an unprecedented 6 months navigating this pandemic. And just from a physician's perspective, Dr. Connors, what have these last 6 months been like for you, in particular, just navigating things with both COVID and non-COVID patients?
It's been, I've been a physician for 36 years, leadership positions in urgent care for close to 20 of those years. It is the most challenging and difficult time we've ever had. We had concerns about Ebola a few years ago and SARS 20 years ago. And this is totally different. We make changes, every week we've changed something as new information becomes available. It's been exhausting. It's been hard trying to keep up for our staff and for our patients. We have had a difficult time encouraging people to come in for other reasons because we're afraid. I think people are a little less afraid now. Our incidence in this area has dropped tremendously. But early on, for those first 2-3 months, people would delay coming in, and you just sit there and go, why'd you wait? And they were like, I was afraid. They were afraid to come out. So it's been the most challenging time in my entire career.
How much of the urgent care process has changed with health and safety protocols that have been put in place, both for the physicians, the staff, and also for the patient process?
Well, I was thinking on the way here, and I was thinking, when Rip Van Winkle went to sleep for 20 years and woke up and found everything changed, you'd find probably more stuff changed from the beginning of March to now than he found when he woke up after 20 years. I mean, for the whole time I've practiced and before that, we've pretty much done things the same way. People would come in, they'd stand in line, they'd sit in the waiting room, and all that stuff's gone. And most of the changes that we've made are changes to try and keep our patients safe, our staff safe, try to have it make as much sense as it could without interfering with the patient interactions between the provider and the patient. In past years or up until early March, you would check the website, see the wait time wasn't too bad, come in, stand in line, talk to the secretary, give them your insurance card, do your copay. If you had an emergent symptom, you would be brought right back. Emergent symptom like chest pain, short of breath. I have an allergic reaction to a bee sting. Those would come right in. But everybody else sat in the waiting room. They waited their turn. We got to them as we did. And then on the way out, they stopped and, made sure they didn't need anything on the way out. And yes, we cleaned rooms in between, but nowhere near as seriously as we clean them now. Now, of course, you still check the website. You come. When you get to the front entranceway, there's a screening person. That screening person takes your temperature thermally, or touch you. And they ask questions. Do you have a sore throat? Do you have body aches, a fever, cough? The questions that the CDC recommends that we ask, trying to figure out if people might be at risk for COVID. We have also split our sites. So currently, Hopkinton is our only site that sees respiratory type patients, COVID possible patients. Our other 3 sites, Northbridge, Franklin, and Milford, only see non-COVID patients. So patients have to pass the questionnaire. If they get a negative all the way down the line on the questionnaire, they can be seen at one of those other sites. Recently, we added non-respiratory patients to Hopkinton simply because the site is configured such that we can separate the 2 groups of patients out. So we've never separated respiratory and non-respiratory patients out at our urgent cares. And so that we're doing now in an attempt, again, to try and keep people who don't have respiratory symptoms from getting respiratory symptoms. Once the patients pass the test of wherever they are, unless they have an emergent symptom, they go back to their car. And the secretary calls them and registers them over the phone. So there's no standing in line, there's no contact. Having done that, what happens next is the medical assistant or nurse will call the patient from the car and go over the things that we used to go over in the room. What medicines do you take? What are you allergic to? Confirm the symptoms. And then basically what they tell the patient is, we'll come out and meet you at the door. They come, they meet them at the door, they bring them to a room. The patient really doesn't touch anything on the way into the room. In the room, they finish taking their vital signs, their blood pressure, their pulse, their respiratory rate, and they do a pulse ox, which is a measure of oxygenation, something that you just put on a person's finger. And then they leave the room. So the patient's time in the room, and there's no such thing as a waiting room anymore, is limited. The difference, of course, also when the patient hits the door, excuse me, they are given a new mask, a new face mask. If they have a cloth mask, they can wear it over if they so desire. Otherwise, they swap it out to one of our masks, which is fresh. If they have anybody with them, anybody who's going to come in the room with them, that person also gets a new mask. So patients masked in the room. When the provider comes in the room, the difference is I used to walk in a room, shake their hand, introduce myself, we'd pass some pleasantries. And of course, now when I come in the room, if it's a non-respiratory site, I have gloves, a face mask, a surgical face mask, and eye protection. If I'm at a respiratory site, I have an N95 mask, which is filters particles more effectively than a surgical mask, then a surgical mask, and then eye protection, and then a gown. So totally different. We never used to do that with anybody. You see the patient the same way you did. And then when the patient leaves, they pretty much, like, we point them toward the door and they walk out the door. In between patients, we always wipe down the exam table and stuff like that. Now the room gets a much more extensive wipe down as far as the door handles, the faucet handles, the faucet, the thing. Anything that might have been touched gets wiped down before the next patient. So it's totally, I mean, the patient care is still the same, but all the pre and post is totally different. And It's an attempt to keep people as safe as we can. And it's changed over the months depending on how the information has come in.
It's such an incredibly helpful walkthrough to really know that entire process, and I'm sure that will put a lot of folks' mind at ease. I'm sure there are a lot of people out there who have had some concerns about going in for non-COVID care. So really great to hear just how comprehensive the protocols are that are in place throughout the urgent care Milford Regional locations.
Yeah.
So Dr. Connors, I want to get into really the details on the new COVID rapid testing that's going to be available at the urgent care locations. Talk specifically, if you will, about the specific test that you're offering and the details on how that test is administered.
Absolutely. The rapid test is it's called an antigen test, and what it looks for is viral antigens. It is essentially the same kind of test if you or any of your viewers have ever had a rapid flu test. Essentially, that's the test. Rapid flu tests look for flu, influenza, viral antigens, and that's what this test looks for. It is very effective at picking up people who have a significant amount of viral antigen. The test that is done at the hospital and that the governor requires for travel is called a PCR test. And what that test does is it amplifies the genetic material of the virus. So it's a more sensitive test. The wait times to get results can range anywhere from a day to a week, depending on which outside lab is doing the tests. And the hospital, for instance, has the ability to do the test in-house, which cuts its time to an hour, but there's a limited amount of reagent of the material that needs to be present to run the test. So there's a shortage of the test material. You can swab anybody, but you need the solution to run the test. So it's a problem all around that it finds the virus more often than the antigen test, but it's harder to get results and it's harder to get reagent. Then the upside of the antigen test is that it finds people who are contagious. The infectious disease specialists in Milford Hospital, basically, they view the antigen test as being an excellent test to decide if you have the ability to pass the virus. The PCR test will tell you if you're sick, if you have the virus, but it doesn't tell you how contagious you are. The antigen test is much more likely, if it's positive, to say, yep, indeed, you are contagious. The hospital itself has actually obtained one of the machines that we use, and they are using it currently from admissions from the emergency department to the floor as a way to screen out people who need to be under precautions, isolation precautions. So if you have no symptoms, minimal symptoms, and you're being admitted for a leg cellulitis in the ER, they'll do this rapid test on you. And if it's negative, they consider it acceptable not to do precautions, not to put you under special precautions that they would for a patient with potential COVID. So from a practical point of view, it gives you a quick answer. It tells you who's contagious, and it's a test because it's an easy test that can be repeated. So if you come in on a Tuesday and you have symptoms and you're negative, and 2 days later you're feeling worse, you can come back, we can do the test again. People will often be positive. So that's the advantage of the test is that it gives you that quick answer. It gives you an answer that really speaks to how contagious you are. Will it miss some people? Yes. But the infectious disease people at the hospital feel that the people it misses are people with extremely low viral antigen that likely aren't contagious.
And how quick is that result, Dr. Connors? Do folks get the results of that test before they leave the facility?
They all get. It's a 15-minute test. If the test is positive, I've seen rapid flus turn positive in less than a minute. So sometimes the results are even quicker than that, but 15 minutes is the length of time of the test. So all the patients that come to urgent care, first of all, we make sure that they don't need the test because they're trying to comply with the governor's travel ban, because the governor was very clear that he wanted a PCR test. So we have no interest in doing something that's not something the patient needs. We then, once we swab the patient basically sits for 15 minutes. We do give them a handout from the manufacturer describing what the test is, what its pluses and minuses are, so that they have a chance to read it. When the test is resulted, then the provider goes in and we talk about the results and we talk about the pluses and minuses of the test. If the patient needs a note for his work or school that he's had a negative test, we provide it for them, and then they leave with the information that we've provided for them.
That's great. And now, Dr. Connors, the process for people to come in to receive the rapid test, is this strictly on a walk-in basis, or can you make an appointment to receive the rapid test?
This is actually on a walk-in basis. I mean, the majority of this is, and you get the same thing. You get the thermal temperature, you get the questionnaire, make sure you have no symptoms. And then mostly it's once you're swabbed, it's just a matter of time, and the swabbing's fairly quick. We have adult patients self-swabbing, being watched by a staff member. If some people have trouble putting the swab up, you got to put it up part way up your nose, not very far, but a little way. And people are somewhat reluctant sometimes. Staff members there, they'll swab for you. And anybody under 18, we have the staff swab. So it's non-appointments, and it's a fairly quick thing because it's sort of most of it happens on the side, while we're doing other things. The staff is swabbing, and then you just kind of sit and hang out until we get the result, and then you're done.
And so you've talked about the rapid antigen testing is available at each of the urgent care locations. So that's Milford, Hopkinton, Franklin, and Northbridge. And also, you've talked about the PCR test as well, Dr. Connors. That test is available specifically at your Hopkinton location. Is that correct?
That is correct. Currently, the hospital only has sufficient ability to test symptomatic patients. Okay, we just don't. Again, it comes down to you don't have enough of the reagent, the thing you need to run the test, and so we only do symptomatic patients. We do PCR testing. The results, again, can come back as quickly as the next day, or it can take several days. We will be discussing, as we are coming into the fall, which is a respiratory time, that potentially, much as the hospital is using a rapid COVID test, and we've used rapid flu tests for years, the medical director and myself and our infectious disease specialist are going to be discussing, as we come into flu season, will we be doing more rapid COVID testing on symptomatic patients, because the volume goes up dramatically, even in a mild flu season.
All terrific information, Dr. Connors. And just to give folks an accurate picture of what to expect when they come in terms of the rapid antigen test, is this something that's typically covered by insurance?
Asymptomatic patients are not covered by insurance, and that's a PCR test, rapid test. And so there's a $150 charge. And like I said, we make sure it's not that they don't truly need a PCR test. We have no interest in taking their money if it's not of any use to them. And a lot of businesses want to test. They're not specific. They don't care what kind of test. Schools, a lot of kids going back to college. The college is not specific. And so those are the people that we do. There are places you can go for asymptomatic PCR tests, but the wait times can be long to get a result.
Great to know. And so, Dr. Connors, as we wrap things up, is this a temporary program in place for the urgent care locations, or is this right now open-ended for how long you'll be providing these rapid tests?
We expect that we'll be providing these tests for the foreseeable future. I don't think any of this is going to go away soon. And I think you'll see more and more rapid tests. If you watch the news and look, there's a company, a group trying to develop a saliva test that people could use at home every day and test themselves every day. And again, it works on the same basis as an antigen test. But the idea is if you swab yourself every day, when you get a positive test, then you know. So I think you'll see more and more antigen testing being done as the volume of respiratory illness goes up in the fall and winter.
Rapid COVID antigen testing now available at all of Milford Regional's urgent care locations. Dr. Michael Connors, urgent care physician leader with the Milford Regional Physician Group. I want to make sure I get that right here. So appreciative of you taking the time to join us, and this has been really just tremendous information, and we hope to have you on again if we have more information to share with the public. But in the meantime, we really thank you for taking the time to join us this week.
It's been my pleasure.
The town of Milford organized a War Memorial Revitalization Committee to help spruce up some of the historical sites around town. Efforts are already underway for a much-needed facelift to Draper Memorial Park. And we had an opportunity earlier this week to sit down with members of the War Memorial Revitalization Committee and also other representatives from around town to learn more about these efforts and also to tell Milford residents how they can help pitch in this effort. We are so happy to be joined on the Milford Informer this week by 4 members of the War Memorial Revitalization Committee here in Milford. Really some exciting work on the verge of being done with the help of this committee. So we're so happy to be joined this week by Peter Scandoni, Paul Malnati, Joe Lufty, and State Representative Brian Murray. Gentlemen, thank you so much for being with us this week.
Thank you for having us.
Yeah, it's an honor.
So Peter, I really want to dive in right with you. This is such an exciting process that you guys are going through with the end result to do some much needed work to really transform the Draper Park area. If you could, Peter, I'd love for you to really go through the origins of this, how your committee first got started, and really what were the conversations around town that really were the impetus to get this project going.
Well, probably going back to the first function that Citizens for Milford did on the park. I think it was a Veterans Day function. And around the same time, that's probably 4 years ago, we had the Field of Flags begin at that time. So my wife and I, first of all, my wife Claudia and I, we would walk around the park and just be disturbed seeing the condition that it was in. And then from there, over a couple of years, we discussed it at our Citizens from Milford meetings, and eventually we decided to put together a committee. We went before the Selectmen's meeting, and Selectman Bill Buckley appointed us as an ad hoc committee at the time of 13 members. And then myself and the late Steve Treadle, my good friend, we then began recruiting members, and we have 13 members now. And we meet over the last year, probably every month. Sometimes we skip a month here and there if there's nothing to discuss. And it brings us to the point where we are now. The repairs that struck us, was everything. The trees were diseased, the lawn needed repairs, the irrigation system needs to be replaced, the stonework has to be pointed and grouted. The statue needs to be repaired. The bottom of General Draper's sword is missing, about 4 inches of it. The base has to be repaired. The benches have to be replaced. All the brick decking has to be taken up and cleaned, and the subsurface has to be replaced. So all of that has to be done, which is going to be very expensive. And the park department is doing a wonderful job in aligning all this work that has to be done. So brings us to today, actually, which is trying to get getting donations to support all this work. And we're just very glad you're having us on.
Well, it's certainly our pleasure, and we want to make sure we get all of the details for how folks can get involved and donate to this project in just a little bit. State Representative Brian Murray, I want to turn things over to you. Obviously, a lifelong Milford resident, you care so deeply about the history of this community, and Draper Park is such an iconic part of the Milford community. Can you speak to a little of the history and significance of Draper Park in Milford?
How much time do you have?
Yes, Draper Memorial Park, as it was, I guess, formally named when we did the renovation in 1992, really is the cultural and community centerpiece for our town. And the obviously the most characteristic, the most striking characteristic is the General Draper statue, which really is a work of art. It was designed by Daniel Chester French, and the pedestal and the park design originally was done by Henry Bacon. And both of those two artists also collaborated on a number of other monuments, most significantly the Lincoln Memorial in Washington, D.C. So, you know, to have that kind of national treasure within your community is something really special. Daniel Chester French, I think, only did 5 equestrian statues, one of which is right here in our town. The park was donated, or I should say the monument was donated, I think around 1912 by the General Draper's wife after he had passed away. And for the longest time, his family, his daughter, had paid a yearly stipend for the maintenance of the park. In 1992, well, let me backtrack a little bit, because another monument that's in there, the large granite wall that the general faces, that's a World War I memorial that was placed on Armistice Day in 1939, and it lists the names of about 800 or so veterans from World War I, and the ones who lost their lives are marked by stars. Moving fast forward, in the late 80s, the early 90s, the town undertook a entire redesign of the park and incorporated the curved walls that you see, which list the names of about 3,300 veterans who served in World War II, Korea, and Vietnam. And the theme is a continuum of time. If you note, there are individual blocks which coincide to the dates, to the months and the years of each war. And the months where veterans who were killed are marked in blocks of black granite. And you'll notice, you know, for example, June 1944, I think has the most names on it, which was D-Day. And when we did that project, I was the chair of the committee that did that. We made sure that not only the name of the veteran who lost his life was listed, but the date and the age of the veteran. And I think there's a couple there that are 18, 19 years old, which is, you know, really kind of brings home what I think the entire park is meant to memorialize and commemorate. So, you know, in 1992, when we did that, we really, you know, tried to clean up the park, took some other things out of there so that it would be a true showcase and memorial to our veterans. And it's by and large stayed that way. And I think since that time, as Peter talked about, there are some amenities that certainly need to be updated and improved. And I think that gave the impetus to this committee to do the work that we're doing now.
It's really just incredible to really listen to just how deeply meaningful the history throughout that park is. And I want to bring into the conversation Joe Lufty, who is a Vietnam veteran. And first of all, Joe, we want to thank you so much for your service. And as a veteran, how meaningful is it to you to have this park continue to be such a tremendous resource in the community to honor the history of military veterans?
Well, one of the things that I remember distinctly coming back from Vietnam is the welcoming that we got that was less than warm. And this park now, to see, I go up there and I see my name there and I see the names of my friends, a lot of classmates and everything else. It feels good to know that somebody did recognize what we did. I'd like to see the park continue to reflect that. That's basically why I got involved in this with Peter and the committee. Is I know most of the heads of the veterans organizations in town, and I can get feedback from them, and I'm more than happy to listen to any veteran that really wants to talk about what they would like to see at that park and what needs to be done. And doing a walkthrough in that park, if you look at the park, it looks like there's nothing wrong with it from a distance, but as you walk through it, you find all kinds of little nagging defects here and there caused by either traffic or wear or whatever over the years, and it would be really nice to bring that park back up to the standard that it was at when Brian and his committee made that.
Absolutely. And Paul Malnati, I want to bring you into the conversation as well. You're also a member of the Downtown Revitalization Committee, and I know that Milford's had such a commitment to really, revitalizing and re-energizing the downtown area. How much would giving a facelift to Draper Park go towards really boosting those efforts?
Yeah. Tim, when we formed the Downtown Revitalization Committee, we first had to come up with a definition of what really we thought the downtown should be, and it was quite apparent just from the very beginning that if you look at our two municipal parks, Draper Park on one end, the south end, and Calzone Park on, I guess, the east end, those were natural entries into the downtown area. So when we made our map and defined the downtown on what we wanted to initially work on, those were designated the gateways to the downtown district. So it's extremely important to us that both of those parks show very well. That's the first thing a lot of people that are unfamiliar with Milford as they come into the town recognize. So Draper Park, when the committee was formed, it was actually Jose Costa came from me from the citizens from Milford, and he said, we'd like you to serve on it. And I said, it'd be great, but I'd like not only to look at Draper, but I'd like to include Calzone. And that's where we kind of got the impetus to do both of them. But as we try to revitalize the downtown area, we certainly want to have our municipal parcels of land, our municipal buildings, and the parks to show their best. And this is a great opportunity for us to engage in a civic process to really help out the efforts for the bigger objective, which is to eventually get a more vibrant, more active downtown area. And the one name that we haven't mentioned yet was Mitch Rossetti, and Mitch was instrumental in recognizing that this grant was available, that it was an opportunity for us. And Mitch was brought on early in the process with the Revitalization Committee to help look for grants such as this. So when Mitch earmarked this particular opportunity for us, it was I guess a no-brainer to follow through. It took a little bit longer than what we had hoped to get the funds, but the end result is quite appealing to us in a number of ways.
It's just so clear that that this project is so worthwhile and it's going to be so meaningful to the community. Obviously, funding the project is a big component of this, and that's where I want to turn back to you, Peter. Is part of the funding for this? You're looking for crowdfunding here for help from the community. Can you dive in a little bit to the process of how folks can get involved and make donations to really help make this project a reality?
Yes, there's two ways to make a direct donation. You can go to the patronicity.com/Milford website, or you can go to Citizens for Milford website, Citizens for Milford Facebook, and there's direct links there to get right to the page where you can make a donation. It's tax deductible. It's easy to follow. You get to the first page and it says support support, drill down, and it just walks you through it. On the Citizens for Milford and Facebook page, it also has frequently asked questions if there's any confusion about how to make a donation. You can also mail a check directly to the town of Milford and indicate in the memo section Draper Park revitalization, and mail that to the treasurer's office at Milford Town Hall, 52 Main Street. So those are both ways to make direct donations. And like we said, it's 85,000 we can accumulate through this mass development grant program, but it's going to take more than that. So anybody that can donate would be greatly appreciated. There's large businesses in Milford that are very successful, may want to give back to the town. We would appreciate that very much. As Brian said, it's just a Milford treasure, that park. And thanks to Brian and his group back in the early 90s, they redesigned it, and it's just a beautiful thing to walk through and an honor for the veterans.
And Brian, I do want to go back to you. So there is funds being matched from Mass Development as part of this. Can you talk a little bit about Mass Development and their involvement in helping to get funds raised for this project?
Yes, and echoing I think what Paul and Peter said, I've been very impressed with Mitra City because he really kind of spearheaded this at the local level and kind of guided us through the process. It's an application process through this department of the state, which is through Housing and Economic Development. And it's a matching of $42,500. So if we can raise that amount of money, they'll step forward and contribute that as a match. There were a number of requirements. I think there was some delays in the process because of the COVID-19 pandemic. But again, I really am so impressed with Mitra City as to how he kept the committee apprised of it, guided us through this process, and brought us to where we are now. He did a really good job.
Paul, I know there's already been some preliminary work done on the park. I know folks have seen the trees that have been replaced so far this summer. Can you talk a little bit about that work that's been done already, and maybe some of the earliest phases of this project that you guys are hoping to get underway as quickly as possible?
Yeah, you mentioned the trees, Tim. So yeah, that was done mid-May, and as you can expect, there were some people who were upset that the trees came down and didn't realize that new trees were going to go up in return. So some of the initial comments were quite negative, but I think since the new trees have gone up, people understand that there's a process involved, and it's all being done for the betterment of the park. But we haven't mentioned as well credit to as well, and that's Jim Asum, who's head up the project on the park side. And Jim is a member of the committee, and he's been very hands-on with us in this whole process, and has really been very good about communicating with us and providing information. But he has a process that he has to go through right now as the superintendent for the Parks Department to make sure the next phases are handled correctly, whether it's the bidding of the lighting project or the bidding of the redoing of the stone. So over the next couple of months, as we continue to fundraise, he's going to be working very diligently on the next steps in the revitalization. So I think his intent is by the end of this year to have most of what had been planned for the park completed, but there's probably some work that'll go into next year. But the hope is we'll have new lighting, we'll have a clean monument, cleaned stones, walkways repaired, the trees, as we talked about, new landscaping, signage, and then I think it's also going to get resodded. So it's going to be a complete redo for the park area.
Well, once again, patronicity.com/Milford is the website, a pretty streamlined process to be able to get donations in there. You can also mail checks into Town Hall as well. We'll have all of the process for that up on the screen for you. Joe, I want to come back to you once again. When you sort of envision what the park is going to look like when this renovation project is complete, I would imagine it's pretty exciting to think about, again, just being able to honor all of the history there and really maybe making it accessible to a whole new generation of Milfordians to be able to walk around this newly improved park and really appreciate just how much history and significance lies within that park.
Well, one of the things I remember about that park that my grandchildren were up just recently from Virginia, and they went down to the park and they saw my name down there, and they came back and they were so happy they saw Grandpa's name on the wall. I think it means that the people that did serve and have served from our community will not be forgotten, and that our community really cares about the people from Milford that serve their country. I originally got involved in this mainly because I had the honor of being Grand Marshal of the 2019 Memorial Day Parade. And I have never been more choked up than when we stopped at the Doughboy and I got to put that wreath there. That just brought every emotion that I ever had about I don't know, it's just hard to explain. It brought a lot of emotion to me, and it really made me want to get involved in making sure that every veteran in this town is not forgotten, no matter what war they participated in. And in that vein, I hope that somebody from the community that was some of the veterans that were involved in the Gulf Wars will put something together to get themselves honored, because they deserve to be honored too.
That's so deeply meaningful. Brian, I want to give you the final word here, and just, what message can you deliver to folks out in the Milford community, to local businesses and organizations, to just kind of inspire them to get involved here and provide a donation to make sure that this project can go through to completion successfully?
Well, I mean, it's really a request to help the community. As Paul indicated, it really is a focal point of our downtown area. It's the main greeting, I guess, entrance to the town. Whenever there's any event of significance in the community, that's where it's held. So that's a real reflection of the folks in the community. And anything that people can do to help this project, I think, is only going to beautify the town of Milford, and also really help memorialize and remember the veterans, their family members, and their stories, as Joe had indicated.
That's an outstanding message. Well, we know just how important a project this is. We're so excited from a Milford TV perspective to be able to see this project continue to develop, and we're really looking forward to seeing the results. So again, patronicity.com/Milford. Folks can log on to donate, and we have all of that information for exactly all of the ways that you can donate available to you on your screen right now. Gentlemen, we thank you so much for all of the hard work that you're putting in to make this project happen, and we so look forward to checking in with you again soon to see how things are going. But in the meantime, Representative Brian Murray, Peter Scandoni, Paul Malnati, and Joe Lufty, thank you, gentlemen, so much for being with us this week.
Thank you.
Thank you, Milford.
Appreciate it.
Yes.
With the school year about to begin, there's a lot of uncertainty amongst families moving forward with the new hybrid learning model that Milford has adopted, specifically when it comes to childcare needs. Well, the Milford Youth Center and the Hockomock Area YMCA have collaborated to come up with a solution. Let's hear more of the details now.
Hi, my name is Jen Ward. I'm the director of the Milford Youth Center.
And I'm Kim Jennings. I'm the Associate Vice President of Child Care Services for the Hockomock YMCA.
And we're here today to talk a little bit about a collaboration that we have created with the Milford Public Schools, the YMCA, and the Milford Youth Center. So we wanted to answer, there was a child care gap in the community, and it was clear that with this cohort model that there was going to need to be additional child care, and that's where the YMCA has stepped up, and they're going to actually use our facility to provide care from 8 to 5, every 7:30 to 5.
Yes, and so just as Jen had said, we're working with Milford as well as other communities to help support this coming fall's remote learning needs with the hybrids and the cohorts that are being established in the different school districts. So what the YMCA is going to do in collaboration with Milford Youth Center is provide parents a place to send their children during the days that they have remote learning opportunities. So for cohort A children, allowing families to have programming Wednesday, Thursdays, and Fridays that will support virtual learning, as well as provide the children with some enrichment opportunities. And then on the other side for cohort B families, having a place for their children to go Monday, Tuesdays, and Wednesdays as well. Again, supporting remote learning and enrichment, and then collaborating with the Milford Youth Center so that the students will get their remote learning as well as some opportunities here at the program.
Yep, so our program will not look traditionally like our after-school program. We will be having space for 30 youth. They will be able to sign up through the YMCA portal, and we will have 10 students in the backcourt gym, 10 in the front, and then 10 with some extracurricular programs, some including crafts, STEAM, fitness, and nutrition. So again, those programs would start from 2:15 and run till 5 p.m. and you would have to sign up in advance, and there will be a $20 fee for anyone that is not participating directly within the cohorts of the YMCA program. If they're not, they will be charged separately within that program, which would be $15 a day.
And so we'll be providing the morning components of those programs. So for children that are 5, 6, and 7 years old, the program will be offered again starting at 7:30, where the children can join us at that point and stay with us till 5. And just like Jen said, it will we'll do a lot of what they're doing. So there's a mirror opportunity for the students during the after-school hours, and then during the school day, we'll be supporting the remote learning components with the schools and developing group cohorts, or what we're calling pods, so kindergarten pod, first grade pod, second grade pod, just so we can make sure we're aligning the learning. And then for the children that are 8 and up, they'll stay with us from 7:30 till about 2 or 2:15, and then transition over to this program so that they can enjoy some of the other opportunities with those groups as well. So there'll be opportunities for your children, grades kindergarten or 5 years old straight through the ages of 18, and throughout the course of the day. You just need to kind of be cognizant of what sort of hours you need, and certainly reach out to us with times and opportunities there.
Yep, and we're excited to have you guys all back in the building, and I want to ensure the community that we're following guidelines and safety procedures, so everything and every child will stay within their cohorts throughout the day. So we're excited to have you guys back safely, and especially appreciative of the collaboration with the YMCA and the Milford Public Schools and the town of Milford to really get this all together in such a quick time frame.
And our programs, just as Jen said, as far as safety and opportunity, we are a licensed facility, so that will afford the families the opportunity, if they do use vouchers, that they can use vouchers to help supplement or pay for this program, as well as we have limited scholarships through the YMCA. So if families do need scholarship assistance, we have that available, and then we have just full pay opportunities for families too. Right now, for a full day, it's $50, and then for students that will be transitioning to the Milford Youth Center, it'll be $35 for those students, and then $15 for them to participate in that program. And everything can happen through our YMCA portal, and Jen and I will work collaboratively to ensure that the students are placed in the appropriate groups and done safely and effectively, and certainly providing your children as much normal as that we could possibly do based on the school year coming up.
And we also will be providing food through the YMCA, through the Milford Public Schools, and the state reimbursement program. So we look to provide breakfast, lunch, and dinner, and potentially a snack as well. So that will be up and running hopefully by day one, but we'll make sure that all families are have communication with us so they're prepared of what to bring.
So for families that would like to email us directly or telephone us, there's two ways that you can connect with us. We have an email address, which is schoolsout2@hawkymca.org. And let me just spell that for you. It's schools with an S, so SCHOOLS2@HOCKYMCA.org. And you can also call us at 508-643-5243 and speak to one of our registration specialists there to answer any direct questions.
You also can go directly to the Hockomock Area YMCA's website, which is www.hawkymca.org, and you can click register for programs or directly click out of school time registration to register your child for both the YMCA program and the Milford Youth Center program as well.
Perfect. And our YMCA, again with the Milford Youth Center, we will be offering some additional opportunities for parents to ask us questions and answers. We'll host Zoom calls next week where families can join. We'll be telling you all about how we're working together, what to expect, what to bring, what your student needs, as well as allowing parents to just ask us some unique questions that might be pertinent to their child. Both Jen and myself and the team that will be here to help support the program will be available for that, and we'll be sending that information out to families too as well.
That is all we have for you on this week's edition of The Informer. As we head into the long Labor Day weekend, we encourage everyone out there, please continue to maintain your social distancing practices, wear your mask, wash your hands frequently, enjoy the Labor Day weekend, and we will be back with you next Friday with an all-new edition of the Milford Informer. Until then, from all of us here at Milford TV, this is Tim Coet saying have a great week. So long, everybody.